Scores of neurosurgeons, including those sponsored by the government, declined postings by the Health Ministry due to poor working conditions and near absence of appropriate equipment to work with. That's according to President of the Ghana Academy of Neurosurgical Surgeons, Dr. Abbas Adam, adding there are only 26 neurosurgeons in Ghana, and almost all of them were trained outside the country. For this reason, the Ghana Academy of Neurological Surgeons has inaugurated the nation's first Faculty of Neurosurgery, aimed at resourcing neurosurgery residents with skills and knowledge to manage conditions associated with the nervous system right here in Ghana. Rejoice Semefak Pesu has more in the following reports.
Physicians with a keen interest in neurology and neurosurgery can now embark on a streamlined 6-year program at the facility, eliminating the need for extensive preliminary training in other areas. Chairman of the faculty, Dr. George Wepeba, stated that to address the phenomenon of brain drain in the country, policymakers and stakeholders must equip service centers with the necessary resources and improve the conditions of service of workers.
Brain drain is a big problem, not only for Ghana, it's for, most of the developing countries, and even recently for the developed world also, like the UK, etc. They all have this brain drain thing going on. Now, we have a chronic shortage of doctors, especially in fields like neurosurgery. So when they start leaving the system, then the deficit even becomes more. So how do you address this type of problem? Number one is to make training facilities like this available. Like we started with 18 people last year. If you have a straight fellowship program, you're able to take more people. Whatever happens, there will always be a few of them who will stay in your system. People will feel that they don't have to suffer, work so many years as doctors before they join a training program. So more will be encouraged to come in. And if more are encouraged to come in, you expose them, and you have a country that dedicates certain funding to making sure the resources are available in all the respective institutions in all the regions. People don't go on brain drain alone because of money. Sometimes it's because of not having conditions of service. You don't have resources to work with. You get depressed and you go. So if number one, the policy makers are able to get all the centers which are accredited to have the resources possible for training of this resident, then number one, they would have satisfied at least job, they will get a little bit of job satisfaction, which in the first place will decrease the number of people who would like to leave the country.
The president of the Ghana Academy of Neurological Surgeons, Dr. Abbas Adam, says the faculty is an advancement in healthcare, specifically addressing neurological challenges in the country.
We are 26 as we stand today. But if you check some years back, the numbers were worse. When I came as a neurosurgeon, I came back as the 8th neurosurgeon in the country. Yes, that was bad. And considering when I came as a neurosurgeon to now, it has been quite impressive. But most of the neurosurgeons that make this number 26 are those trained from outside. Those even trained locally are not trained by a Ghanaian program. They are trained by a West African program which has its headquarters in Nigeria. The equipment is key, and neurosurgical equipment are expensive. But it is possible because we've seen it in Ridge Hospital. The government, within the space of a very short period time, has upgraded Ridge Hospital to the international standard. Once we've done it to Ridge Hospital, it means we can replicate it in other hospitals.
The first batch of neurosurgery residents is being sponsored by the government. Some of them have been speaking to Joy News.
This day is a very joyous day for us, a very important day in our lives, because over the years we've been looking forward to a day when we'll have a street training for neurosurgery. Over the years, we've realized that the number of neurosurgeons we have in the country is few, and that doesn't serve the population well. So having this opportunity to go through a 6-year program to improve the total number of neurosurgeons we have in Ghana, and also the neurosurgery care, is very important for us. So we are so excited as residents to go through this program.